Hi, my name is Amir Kazerouninia. I'm a fourth-year Med-Peds resident at Baylor College of Medicine in Houston. I'm here at the American College of Cardiology 2018. It's an honor to be joined by Dr. Allan Klein from the Cleveland Clinic. Thank you for your time, sir.
It's my great pleasure in being here.
So you did your initial training in Canada and then came to the U.S. where you went to the Mayo Clinic where you did a research fellowship. How did this experience help shape your academic career?
Coming from Canada was very important because they have a very good clinical training. And I saw an opportunity in the States, and I got a fellowship to Mayo Clinic. At Mayo Clinic, this really shaped my career in imaging, specifically echocardiography. I had a great mentor at Mayo Clinic, and I stayed there 2.5 years and wrote 7-8 papers on different types of diastology, amyloid heart disease. So I think it really shaped my career in getting my job at Cleveland Clinic.
Okay. And when you were at the Cleveland Clinic, you set up the Pericardial Center. What were some of the challenges to setting up the Pericardial Center, and how has it helped the future cardiologists in helping their careers as well?
Around 10 years ago, the head of our institute, Bruce Lido, came to me and says, "You have this experience in pericardial disease from imaging. Why don't you set up a service line or a clinical center, a center of excellence on pericardial disease?" And I said, "Pericardial disease, it's such a small a niche. How's this going to be successful?" 8 to 10 years later, we probably have one of the largest, if not the largest, pericardial center in the world. We see well over 2,400 patients. So it is very, very unique that patients are coming with advanced, complex, complicated pericarditis. They come for 1 to 2 days. They see the cardiologist, they see the nurse practitioner, they see the subspecialist, they can see the surgeon, they get advanced echo, advanced imaging, MRI, they may see the surgeon. So it's really one-stop shopping. And it's been very good for the patients because they're searching for an expert on pericardial disease. It's also being great for the fellows. We have advanced fellows and clinical fellows. We have researchers that rotate through, and they're seeing these very exotic patients. Actually, on the way here, there was a poster on pericardial cyst, and they were showing this case report or case. And I said, at Cleveland, we just saw 120 cases of pericardial cysts. So just to show the experience.
So you did your initial training in Canada and then came to the U.S. What were some of the challenges in that transition?
Well, in Canada, they really focus on clinical training. So I was very expert in clinical examination, JVP, listening to heart sounds, murmurs. So the big transition coming to a place like the Mayo Clinic was the plethora of cases, the knowledge base, the expertise, the technology. So that was the transition. And also in terms of getting the research going. Actually, a very interesting story. I could tell you a side story that when I came to Mayo, this lonely Canadian fellow, I didn't have a good project. And it so happened when I was at Mayo Clinic, there was the so-called mother of Doppler, Liv Hatley, who is really the so-called the mother of Doppler echocardiography. She had did all experiments in the cath lab with simultaneous echo and cath. She was there, and there was another famous doctor who's famous now, Tom Lucier, who's the editor of European Heart Journal. He was there, and he was working with this Dr. Hatley, and his visa ran out. So he had to leave the next day. And he comes to me, he says, "Allan, I have to leave the next day because of my visa issue. Here's 60 folders on amyloid heart disease." And I said, "I know nothing about amyloid." And next thing, and you'll also be working with this famous Dr. Hatley. So just fortuitously, I transitioned and worked with Dr. Hatley, who taught me a lot of my basics for diastology, and my career was launched. Now, at Mayo also, another important thing that happened is, after 2 years at the Mayo Clinic, I wanted to, go on to get a job, and my mentor, Dr. Tajik, at that time, said to me, "Why don't you stay 6 more months and finish your papers, and that's really going to help you with your career and your next job." And I heeded his advice, And I really focused my last 6 months on finishing all my papers, and I was very fortunate to write 6-7 papers on diastology, amyloid heart disease, and that really shaped my career. And that and it continues on with your next job. You're just finishing off all the papers, and so the point for the audience is try to finish not just your abstract, but transition that into the papers, and that will help you with your career.
And throughout your career, you've helped nurture the careers of a lot of training physicians, from medical students through to fellows. In your experience, what has distinguished people and allowed them to succeed?
Well, first of all, I like to interview the prospective student or a fellow that wants to work with me, and I see right away how motivated, how hungry they are to work in the field. Whether they're going to deliver the results. Because a lot of fellows may come and they say, yeah, I want to work on this project, and they maybe do an abstract at the ACC, and they never write up the paper. So I'm looking for very motivated people that are hungry and easy to work with, that follow through. So that I think distinguishes the fellow. Often we have a handshake, an agreement that they're going to do their best, and from that point of view, as a mentor to mentee, if I see that they're working very, very hard and they're very motivated, and I'm glad to support their endeavors. And in terms of, I just finished the presidency of the American Society of Echo, so I have a lot of contacts and a lot of relationships. So I'm very glad to help all the people that work hard, and the fellow and their med student succeeds. And I'm very happy to see that. There's nothing better to see posters by our fellows or our med students or our residents, and that makes me very, very proud. Because I was there once also, presenting for the first time, so this makes me very happy.
All right. Thank you so very much, sir, for your time and for your insights. For more videos like this, please go to www.youtube.com/FITsontheGO.